Hi, my name is Erica Rice, and this is Healthcare Economics, Spring 2012. I'd like to talk to you today about care bundles, using care bundles to prevent infection. A new Center for Medicare and Medicaid Service rule makes the role of bedside nurses even more pivotal. As of October the 1st, hospitals are no longer reimbursed for care associated with these hospital-acquired conditions: catheter-associated urinary tract infections, pressure ulcers, fall-associated injuries, objects left in during surgery, air embolisms, blood incompatibility, vascular catheter-associated infections, and surgery site infections following open heart surgery. A bundle is What is a care bundle, you ask? A bundle is a set of simple practices that, when performed collectively and reliable, improve patients' outcome. And in these instances, this means hospital-acquired infections or conditions. Here are some bundles to here are some care bundles that I've researched and read over and put together. Catheter-associated urinary tract infection bundle. What it does is you identify the patient and when the catheter was inserted, if it was prior to hospitalization or post. Um, when you as a nurse insert the catheter, of course you will use sterile technique. Determine daily if the patient needs catheter care. Provide daily catheter care and use a stat lock to secure the catheter in place. Complete the required e-learning courses. Another bundle that I've done some research on was the pressure ulcers bundle, and you are to determine if this patient had this upon admission and document it. Documentation is the key for Medicare reimbursement, especially when it comes to these infections. You must document upon admission to make sure um, these things didn't happen while the patient was in the hospital. Inform a physician if a patient has a pre-hospital pressure ulcer and remind him to document it also. Like I said, documentation is big key when it comes to these hospital-acquired infections or pre-admission infections. With a pressure ulcer, you need to make sure you keep the skin dry, turn patient every 2 hours, and identify the source of the pressure ulcer if possible. Because you want to prevent, especially if this patient had this during admission, you want to prevent it from getting worse or them developing any other ulcers while in the hospital. This third care bundle I would like to talk about is fall risk identification and preventing the injury bundle. Elevate a patient's risk for fall. A lot of hospitals now have it on the admission or assessment sheet if a patient is on certain medications, if they're a male, um, uh, neural problems, any muscular problems, all these things you'll check and it will give you a score to add up the patient's fall risk. So you need to evaluate a patient's fall risk. Then you need to identify high-risk patients by placing either a fall armband and also something on the outside of the door and letting the patient know, call before you fall. Make sure the call light is in reach and tell the patient they need to call the nurse or anybody before they decide to get up. You also need to do hourly rounds to check on the patient and see if they need anything and look for and fix all fall hazards in a patient room, like for instance any cords in the way on the floor, any water. Just make sure everything is clear to prevent fall risk. And that is what I wanted to introduce. Care bundles are not new, but I think they're great, and everyone um, should incorporate them into their system. They're cost effective. That's number one, especially, this is the healthcare economics class. Care bundles are very cost effective. They're not expensive at all. It doesn't cost much to implement these things and intervention. The number one thing with preventing infections is, prevention is number one. So these interventions can prevent a lot. These care bundles are wonderful, and I think we could use them in more cases than just preventing infection. And this is my presentation.